Welcome to the University of Washington and the Office of Public Lectures special weekly series, Coexisting with COVID-19. I'm Hanson Hossein, co-director of the Communication Leadership Master's Program and your host. Every Thursday, with the help of some of the UW's top experts, we explore what could be our new normal as we struggle to adapt to the impact of the COVID-19 pandemic. Special thanks to UW Marketing and Communications, the Population Health Initiative, my own Communication Leadership Program, and UW Video. This evening, COVID-19 and mental health. The pandemic has spurred conversations around other widespread societal afflictions it has amplified, from misinformation to racism. But fear of the virus, as well as how long we have all sheltered in place, force us to consider our state of mind. How has COVID-19 affected our mental health? And what about for those who might be most vulnerable, from our Black and brown communities to children in precarious domestic situations? What do we need to know now to cope? As you registered for this conversation, we ask you to use the Thought Exchange platform to respond to this prompt. What mental health challenges have you witnessed in your community during this pandemic? And here are the results. We'll be using Thought Exchange later for your questions to our guests. Joining us for this timely conversation are Liliana Lengua and Jonathan Kanter. Jonathan is a research associate professor at the University of Washington and the director of the Center for the Science of Social Connection. This center works closely with people of color and disenfranchised groups. Jonathan has specifically focused on issues of social and political activism, including police brutality and voter rights. He also researches how people can cope with relational problems and depression. Liliana is the University of Washington's Moritz Family Foundation Professor of Psychology. She is also the director of the Center for Child and Family Well-Being. Liliana studies the effects of adversity on children and how it might contribute to their resilience or vulnerability. Her most current research has focused on the effects of low income on children and their well-being. Liliana has been especially sought out during the pandemic to advise parents on how to support their kids. What would you like to ask our panelists? Use the Thought Exchange platform to submit your questions. You can also vote on which questions are most important to you. It's important to hear from you as I do integrate those questions into the conversation. So please do use the QR code you see on your screen to share your thoughts. You can even snap a photo of that QR code with your smartphone or just follow the instructions on the screen. Well, Lily and Jonathan, welcome.
Thank you.
You heard about this icebreaker question that we had with folks before we started, and the common thread was really how scared should we be about this, especially as we begin to reopen. They're concerned about extreme isolation. And Lily, I'll come to you with the first question. This is probably most relevant to you. I'm concerned about my children. They're isolated from friends. They have inadequate schooling. Routines are disrupted. And as adults try to navigate through this, the kids are ignored. So with that, how have you seen, given your work especially, Lily, how have you seen COVID-19 impact what matters most to you professionally?
Yeah, we've been hearing a lot from parents and families, caregivers, that they are concerned about their children's social and emotional development and their mental health. Right when stay-home orders and distancing orders went into place, we saw marked increases in parents' reports of their own and their children's distress and anxiety. And we've seen those come down a little bit as people have gotten used to a new normal and created a more stable normal around that. But nonetheless, families are still having a lot of emotions. People feel a lot of grief and loss around losing activities and lifestyle and time with friends and family. They've given up major family events like weddings and graduations. We also hear families talking a lot about emotional disruptions and eruptions in interactions in their families. People are around each other a lot and not a lot of space and place to release their stress and their anxiety. Parents are telling us that this 24/7 parenting in the context of COVID-19 is really tiring and hard. They're feeling really worn out. And we are also hearing that families are appreciating more time together and the quality of time that they have. I think that as we've kind of normalized a new normal, people are still feeling a lot of emotions. There's still a lot of emotional ups and downs, and we might think of this as a speed bump in our children's social and emotional development. but it's still being experienced as stressful and anxiety provoking.
Thanks for sharing that perspective, Lily. So, Jonathan, distress, anxiety, a lot of emotions, grief, loss, that's what Lily has seen in her work. How about you? How has the epidemic specifically impacted what you've been working on or seen?
Well, when the social distancing orders came down in Seattle about the middle of March, my graduate student Adam Kaczynski and the lab, we started a study of 500 King County adults. And so every day since then, these 500 residents, and maybe some of them are listening right now, and if you are, thank you. You've been answering our survey every day for almost 2.5 months now. And what we're learning is actually quite similar to what Lily said about the families and the parents, that the strongest feelings, the peak of anxiety was very early on. And since then, things have been just gradually decreasing. And it's really important to, I think, for us to be talking tonight about the protests and all the upheaval that has happened recently. And I don't know if I could quite understand it, but right around June 1st or so, in our data, we actually saw anxiety and depression start to decrease even more. So that's about when the protests were hitting, we saw suddenly anxiety and depression going down even more. And I don't know if that's related to the protests or not, but it's been quite fascinating.
That's amazing that you've been almost having this real-time reaction and being able to have the opportunity to see it as it changes. I'd like to definitely get to the protests a bit later because I think that's a really interesting observation. So you obviously have seen a lot, Jonathan. You've heard a lot. You're learning a lot. Very specifically in terms of now that we are beginning to emerge and that is affecting things that are happening to us personally but also societally, what should we be doing right now to cope as we do begin to start to reconnect to people?
Well, there's a lot out there on the web about coping. And I think there's sort of a standard set of things that people are suggesting, things like make sure you get exercise and make sure you eat healthy and that you have good routines and things like that. I tend to think a lot of that is missing the most important thing. And I think the most important thing about coping for most of us is improving our capacity to feel everything that we're feeling right now without having those feelings turn us towards despair or hopelessness or avoidance. I think the work right now is really increasing our capacity like a water balloon, filling up with more and more water, learning that our human bodies can actually take a tremendous amount of feeling and stress, and we can keep going every day.
So we can expand, that balloon can expand, but it won't necessarily burst too soon is what you're saying, that we have resilience and ability to adapt to a great deal.
Yeah, I think so. I think we're all learning that our human bodies are capable of feeling just an incredible amount of stress and overwhelm, and we can wake up each morning and keep going. And I think the important thing to say here is that this way of looking at coping is a little different than saying we shouldn't be feeling a lot right now. Because of course, many people are feeling a lot, and especially Black people and brown people and people who are in marginalized communities, and all of this is hitting them even more. The consequences of this are not playing out equitably. And so many people are feeling so many different things. And I think the lesson right now is, can we feel all of what our bodies are feeling and still wake up in the morning and still try to make good decisions about who we want to be, and then execute that plan? And whether who we want to be is to go out and protest, go up to Capitol Hill and join all that, or whether who we want to be is to be the best mom we can with our kids and our families, whatever it may be, we can do that even though we're feeling a lot.
Great, thanks. Well, Jonathan, Lily, we're talking about coping, and you heard what Jonathan had to say, and you ended what you last said talking about how things have changed, maybe for the better in families. So what is your advice for coping, especially within the family context where you do have kids?
And we always start with asking parents to take care of themselves. Parents are always asking, how can I help my child cope? And when parents are more emotionally stable and taking care of themselves, they're more present for helping take care of their kids. We know from prior disaster research or community level disasters that parents' mental health is one of the biggest factors that impact child mental health. And so parents taking care of themselves is a first step to taking care of their kids. And then there are a lot of things we can do to help our kids. And the first, and I think the most important, is to listen. As Jonathan said, people are having a lot of emotions. And so really just listening and letting our children express those emotions and their thoughts, and validate. Let them know that all of those emotions make sense, and anything they're feel is okay right now because of everything that's going on. And then we encourage parents to think of a collaborative approach or a coaching approach with their children. We know that children who experience stressful events tend to do better if they are able to think of those situations in a little bit less negative light or a more positive light, if they can build some hope or optimism about the future and some gratitude about what's right now. And so if parents can collaborate with their kids to think of the situation in a different way and help them come up with their own solutions for managing their stress, we think that that's an opportunity to cultivate coping and resilience skills even through this time.
That's really great specific advice. Thanks for sharing that. I'd like to stick with this a bit longer with you in terms of thinking about, we are talking about coexisting with COVID-19, so we'll be making a transition to something where we have to start thinking about what are the longer term effects of all these things. And so what could you say about the impact long term about what this experience will have or has had on our kids?
Yeah, so we don't know much about pandemics like this one, but based on prior research with pretty major stressful life events for kids, like kids who've experienced their parents' divorce or the death of a parent or other major stressors, we know that most children do pretty well, particularly when they have safe, stable, loving, nurturing relationships around them, their parents and their families. When families have other stress in their lives, significant stress in their lives, those are the kids I'm more worried about. Children who already had mental health or developmental concerns to start with are going to probably have longer term mental health issues. And then families who are struggling with economic strain, job insecurity, housing and food insecurity, when parents had mental health issues or substance use issues and possible conflict and abuse in the house, we're really concerned about those children because those are families that were probably already vulnerable before. And longer term, while COVID-19's effects might fade for many of us, I think those families are going to continue to have significant stress in their lives, and that will impact children's mental health.
Jonathan, you mentioned the disproportionate vulnerability of certain communities already before the pandemic, and you heard Lily reference that as well. But you're also monitoring this in real time with the research you're doing and seeing the ebb and flow, especially as these protests begin and continue. And so what is the connection, as you see it, between the pandemic and as the affliction of racism collides and it creates this incredible upheaval? What observations can you share with us about that, maybe from a mental health point of view?
You know, my colleague and Edwin Lindo and Edwin was one of the organizers of the healthcare workers protest here in Seattle last weekend. We wrote an op-ed in the Seattle Times, I think about 2 weeks ago, where we were talking about how Seattleites were doing in terms of mental health. And we made the point in the op-ed that Seattle's Black and brown communities, in terms of mental health, were actually doing quite well. There were no differences between white people and Black people in our measures of mental health. And we thought that was a real lesson for white people, you know, in that what many of us are struggling with for the first time right now because of COVID, many of the conditions where we don't feel safe going outside or leaving our neighborhoods, and there are all these constraints on our behavior and so forth. These are conditions that people in Black and brown communities have actually been dealing with their whole lives in one form or another. And in some ways, the stress of the pandemic wasn't that new to them, and they're actually quite good and resilient in terms of dealing with it. Anyway, we wrote that 2 weeks ago, and then George Floyd happened. And then the protests hit. And looking back at that now, we think, you know, but I think still the lessons are in place. As not just our Black and brown communities and people of color have erupted with this stew of grief and outrage and anger and loss and all of it, not just the people of color, but white people as well. I think it's really important to understand that having all those expressions of feelings doesn't mean people aren't coping well. In fact, I think expressing all this right now is exactly how we would define healthy coping when we're faced with these conditions that many people are faced with right now.
This might be an unfair follow-up question to what you've just said, but I'm just curious, given the horrible tragedy and the killing of George Floyd, how much of a condition was the pandemic in actually creating this widespread movement that would have happened otherwise? We obviously would have reacted very angrily to what happened because it was so horrible. But how much has the pandemic actually made it more widespread and created this incredible movement around the country?
Well, I think there are other experts who can speak to some of those social trends, but what I can say from a mental health perspective is that, we all have a certain amount of capacity to deal with daily stress. And that, for many of us, just daily stress in a normal condition has our cup a certain amount full. And then COVID and the pandemic filled our cup even more. And then the George Floyd protests hit, combined with Ahmaud Arbery and Breonna Taylor, and just a whole series of impacts on Black people. And so, a lot of people are feeling overwhelmed with stress right now. Some sort of unknown combination of all of this stuff has just put people in an unprecedented territory.
Great. Well, thank you for responding to that. Lily, we received a very specific question that seems to relate to your expertise, so I'll try it out and see how you feel about it. We live in a multi-generational home. How do I explain to my kids, teenagers, which I understand you have as well, that going to protest with their friends risks my parents, who are in their 70s, health? What outlets might you recommend for youth to improve their own mental health as all of these things are swirling around us?
Yeah, that sounds like two questions.
Yeah, it does actually, doesn't it? Sorry, take whichever one makes most sense to you.
How to have these conversations with our teens, and they're challenging. And from our teens' perspective, this is their time to make a difference. And for them, social connections and these opportunities to be protesting or even just be around friends who are sharing their passion about these issues feels really important. We may feel like we can enact our passions at home through our various means, but for youth, it's that. And so there's a very tight rope to walk with kids when there's a multi-generational house, and not putting the older adults in the house at health risk. I don't have a great answer for that, just to acknowledge that it's a challenging conversation in many families right now. And again, just using listening and validating and hearing their side and acknowledging that both sides can be true is really important.
Yeah, I think that makes a lot of sense. Jonathan, an extension of that question is another question we received in terms of how do we cope with national tragedies when we cannot safely come together? And obviously people have tried to come together on the streets as safely as possible. But there is that need to connect to other humans around things that really matter to us. And so I guess the question really is around coping. So let's just say that we've got the pandemic in the back of our minds, and we have this movement in the front of our minds, and we're out there on the street. How do we cope from a mental point of view in actually handling that as we act out or act?
I think probably the most important word for me is flexibility. And there are certain routines and practices and rituals that we were used to and that we had come to depend on for dealing with crises, for dealing with loss, for dealing with communal outrage. And we now need to be flexible and find new ways to express these feelings and come together. And even before the protests, so many people were displaying these wonderful and innovative and inventive ways of connecting with each other over video like we're doing right now, and so forth. And now with the protests, people are forced to make decisions and to try to be as flexible as possible and to prioritize their values as best they can. And it's putting people in positions where we're having to make choices that we haven't had to make before. And the more open I think people can be to saying, okay, this is a different context, different situation, so my behavior is going to be different too. I think that's probably the best way to stay as healthy as possible right now.
Yeah. So Lily, flexibility, understanding that we are in a different situation, it brings us to another question that I think connects us to this larger societal issue. How do you balance creating a bright future for your children to cope with anxiety and the reality of stressful life events, and let's say for things like the 2020 election? How do I look at my child in the face and tell them it will get better when I don't believe it will? I think obviously there's other pressures other than just the pandemic, but we, especially here in the United States, especially if you come from a certain demographic, you can sort of say, you know what, things are going to be okay. But you can't say that right now. How do you want to be truthful with your kids, but you also want to be hopeful at the same time? How do we manage that conversation?
I'm going to start by saying what I keep saying. Parents really need to take care of themselves and find their own emotional kind of stance there and come to terms with that themselves. And when we talk to our kids, you've said this already, we have to be truthful. Kids can tell when we're being authentic or not. And we can think about it as truth, but developmentally appropriate explanations. I think what our children need to hear from us, that people care, people are trying their best, that in these situations, whether it was COVID-19 or in talking about police brutality or talking about the election, that there are a lot of people who are working hard, and as a family, we're working hard to make things right, and we'll do what we can to protect you. So just messages about the effort that people are putting into this and where people's hearts and minds are, that there are plenty of people with their hearts and minds in the right places to try to do the right thing. And from that, children can be assured and hopeful about a future where people are working and making their future better, even if we may not be able to promise that we'll succeed this election or this time around.
Well, I love that advice, and I actually have my 12-year-old daughter sitting next to me for this interview, and I used to be a war reporter, and so, raising my kids, I don't want to sort of sugarcoat things, but I don't want to give them everything at the beginning either. So, for example, I would read Lord of the Rings to my daughter when she was younger, just to sort of give a sense that there is good and evil out there without getting into the hardship that a lot of people face around the world immediately. So I really like that advice. I'm curious, Lily, for you, Jonathan mentioned some of his research that has been happening during the pandemic. How would this affect your own work moving forward, or is even it affecting it now?
Yeah, we're doing some research on the mental health impact on some economically vulnerable families. We had an ongoing study of new moms. We've been following them since they were pregnant, and they were lower income families. And so we've just been wrapping up a survey to find out how this has been impacting them and their mental health and their children. So we'll know more soon about that. And I think this is another great opportunity to really think about how parents and parenting serves to support children's emotional development and coping in difficult times. This is an unusual time in that everyone's experiencing the pandemic, but not everyone is experiencing it equally. And so it's an opportunity to see what variations in experience and what variations in parenting make a difference in children's development.
Sounds like there's a lot for us to learn even as we're going through this hardship. Thanks for that.
Yeah.
Jonathan, a question we had very specifically about what is the one thing I can do to support others' mental health without consuming too much of my own energy in mental health? Any specific advice about that?
What is the one thing we can do to support others' mental health?
Without expending too much of our own and keeping ours as positive as possible.
Well, I think I'll echo what Lily has said before. I think one of the most important things that we can offer people right now is empathy and listening. And there's a difference between thinking of yourself as a good, kind-hearted person and being able to really identify what somebody is feeling and what somebody needs in the moment of an interaction. It's like a difference between empathy and what we might call empathic accuracy. And empathic accuracy, when I'm having an interaction with somebody and I'm able to recognize this is what this person's feeling, this is what this person needs, and reflect that back to that person, that's one of the best predictors of having a relationship that is soothing for that other person out of anything. So really trying to just stay focused on listening and listening for feelings, and letting that other person know that whatever you're feeling, as Lily said before, it's understandable, it's normal, I don't think you're crazy, I'm here with you, you have my support. that kind of stuff, I think, is the most important thing from the research and also from my personal experience.
So those are the kind of useful responses that you can begin with in terms of, yes, you're listening, and then those are the immediate responses you should give before you start getting into a more thoughtful conversation around it.
Probably one of the biggest mistakes people make in relationships is when they hear how somebody is struggling or somebody's feeling something unpleasant, they immediately go to advice or problem solving, trying to make the person feel better, tell the person it's not that bad. That tends to backfire. And the harder thing, but the thing that's more important, is to really just listen and validate, say, I understand, this sounds really tough. Maybe even joining that person in those feelings rather than trying to make those feelings go away.
Yeah. Lily, you've alluded to this already, but given that this is a series about coexisting with COVID-19, there seems to be two mental health issues here at play at the same time, and one will probably, hopefully, go away a bit more, while the other one will continue to play out. That there's the fear of getting COVID-19, and then there's the duration of this incredible isolation, that self-isolation we've had during this quarantine, and that's changing, but the fear remains. And so I'm curious, what is the difference in terms of the impact on our mental health between the fear of the pandemic and also this problem of isolation?
Yeah, I think you're right. I mean, initially there was a lot of anxiety and distress about the virus itself. And as that may be dissipating, although I think what we're hearing from national surveys are that people are worried about a second wave. So I'm not so sure the anxiety around the virus itself is gone entirely. But as we start to open up and things become more normal, I think people are less anxious in kind of in an intense way, but more there is anxiety about the uncertainty of what the next few months are going to look like and how long this is going to go on. And people are feeling, I think, worn out and tired. I think when we thought this might be something we're dealing with for 2 or 3 months, there was a lot of enthusiasm about we can do this and cope. And now people are feeling a little bit more, I think, demoralized and just worn out. And so I think what we might see in children is increased irritability and opposition. They might just start fighting back more, and parents might need to be prepared for that. And there is anxiety about, will there be school? What will school look like? What is my summer going to look like? So I think, even though it's maybe about a different thing, there's still some distress and anxiety. I think if we start thinking of this more as a marathon instead of a sprint, that, we need to kind of preserve our energy, make sure we're building our own resilience so that we can build our kids' resilience too.
Yeah, well, clearly you're in this for the long haul. Well, in our last few minutes, we've received a few very specific questions that I'd be happy just to have either of you respond to, depending on how you feel. And you can maybe put your hand up. But I'll just quickly list them off here, and just feel free to say, yeah, I'll take that one. Well, one question is, what are some habits, and people are looking for specific advice here. What are some habits I can engage with to be more productive, despite my dwindling mental engagement at work? People are also looking for tangible strategies in terms of, once you have listened to other people and tried to be empathetic, what else can they do? And finally, any book recommendations, especially if you live by yourself, in terms of managing this. So given those sort of three questions, which are all looking for very specific advice, do either Lily or Jonathan want to go first and maybe giving that particular closing words that people can take away with them? And Lily also did provide some links that we'll share at the end in terms of where else you can find some resources around this.
The second question on what else to do other than just listening and validating. Yeah, I think there are lots of things people can do. I just want to point out that doing that well will get you 90% of the way there. So don't underestimate the power of that. But obviously, there are lots of things people can do. Expressions of gratitude and appreciation to other people. For example, research shows it doesn't just help the person who receives the gratitude, it helps you as well. Anything we can do to offer tangible resources and support to other people right now actually will help other people, but it'll also help our own emotional health and well-being as well. So doing any of those sorts of tangible kinds of ways to support people, when we actually donate to organizations, that has measurable impacts on our bodies and our own emotional health and well-being as well. So we're not just supporting others when we do that, but we're helping ourselves as well. I could give a bunch more, but I know we're running out of time. So I want to see if Lily wants to jump in with any thoughts you have as well.
That's great. And Lily, any closing thoughts, whether any recommendations about better habits or book recommendations for what people can use moving forward?
Yeah, I'll tackle that first question a little bit from a child's perspective, but I think it applies to adults as well. And that is that I've heard a lot of people saying they're lacking motivation, their attention is really disrupted, they're having trouble persisting in tasks. And I think part of that is would be supported by having a loosely structured day where we mark the beginning, middle, and end of our day with nice routines or activities or things that really mark those times. That's really important for kids. It can really reduce a lot of anxiety for them to have a predictable day. And I don't mean a highly structured day. I just mean some rhythm and predictability to the day, especially a beginning and a closing. I especially encourage, just having like a pattern that mimics our work schedules. And then make sure to build in a block of time that is device free and electronics free, so that we're building in physical activity, creative time, reading, listening to music, something that really can be refreshing and rejuvenating. And if there are people in your home that you have an opportunity for face-to-face interaction, children thrive on that. And I really encourage parents to find 5 or 10 minutes a day to give your child your undivided attention for just some fun time. Kids really can use that to build their own trust and security.
Well, I'm taking notes, so that was really incredible advice. Thank you to you both. Thank you, Jonathan Kanter and Liliana Lengua, for helping us cope with the mental health challenges of this pandemic. The UW Center for Child and Family Wellbeing provides additional mental health resources, which you can find at the bit.ly URLs that you see on your screen right now. Thank you for that. They include supporting parent and child well-being, as well as talking with children about race and racism. So with that, we bring to an end the 6th episode of Coexisting with COVID-19. Binge watch them all at bit.ly Coexist Archive. And join us next week, Thursday, June 18th at 6:30 p.m. Pacific for our next conversation, The History of Global Pandemics. We'll explore what we can learn from the past to overcome our challenges now with UW experts Anne-Marie Kimball and Stephen Goudreau. You can register for the event free of charge at coexisting.eventbrite.com. And we're ready to kickstart that conversation with you. What would you like to know about the history of global pandemics? You can answer now by opening the camera app on your phone and pointing it at the QR code on the screen, or you can go to tejoin.com and enter the code 303-675-106. I'm Hanson Hossein. Thanks for joining us for Coexisting with COVID-19. To quote my former television news colleague, Lester Holt, be good to yourselves and to each other.